This is COVID-19 Seattle. I'm Dave Ross.
And I'm Aaron Granillo.
In a minute, we'll get to the news of the margarita deliveries to your front door. But first, we've been asking this week where the majority of coronavirus cases are concentrated here in Washington. We finally have the numbers today. Aaron, what are they?
So about 20% of total cases actually started in nursing homes, and nursing homes also account for more than 60% of coronavirus deaths in our states. Now, there are cases in more than 200 of these facilities now, but State Health Officer Dr. Kathy Lofi says the situation is improving.
We are seeing a decrease in the number of reports of new positive cases in long-term care facilities per week.
And she says they're also usually able to test everyone in the facility now as soon as someone tests positive, something that was a challenge in the past. So, 60% of total cases in nursing homes still means about 4 in 10 people are catching it elsewhere in our community. Does that make you feel any better about how widespread this virus is, Dave?
Not really, but these numbers are hard for me to use in any meaningful way. I guess I'd like to know what, I guess you have to bring the odds makers in to say, what are the odds that if I step out of my home and shop once a week that I'll get the virus? Mm-hmm. Because I never hear, for example, of, we're getting something like, 200 to 300 new cases a day in Washington State. It's staying pretty steady. It's not going down. Does anybody ask where these people were before so that we can say, 100 of these people apparently got it while shopping, and 100 of these people got it while passing a stranger on a hike somewhere? That's the kind of information that would help me. I've seen plenty of numbers, but I still don't know how to interpret them in a useful way.
I wonder if contact tracing is going to help answer some of those questions for you, because we know the governor wants to hire this brigade of 1,500 contact tracers, and that might answer some of those questions, perhaps. I mean, people will be asking, who were you in contact with? Where were you? So maybe we'll get more of those data points later on. Right.
That's the whole point. And for people to be as truthful as possible, this story that was spreading about the intentional COVID party, which has now been drawn back, that doesn't help me have any confidence in what I'm hearing here. So I think for the sake of for everyone to know what's true, the evidence is with us, right? This is all about each of us truthfully reporting, if we get it, how we think we may have gotten it, so we can educate others and maybe avoid it. But I think ultimately, let's face it, people are getting stir crazy. People are rebelling, sometimes on a large scale, sometimes on a small scale, because you can't stay shut down forever. And back in the day, people just got it and did the best they could. And it's harsh to say so, but it looks like that's the way this is going to turn out. The cases are not going down. And based on how I read the governor's phased approach, we would never leave phase one, correct? Because I think each of the phases is dependent on showing some meaningful change in the infection rate.
And another thing, too, is as we get more and more testing, more and more people are going to get sick. So that long tail we've been talking about, that 200 to 300 new cases each day, will that ever drop if we get more and more rampant testing here? I don't know.
Yeah, well, I want to see more testing, but I also want to see the people tested at least say, this is how we got it, so that if there's something we haven't thought about. For example, when we reopened golf, right? I hadn't thought about the fact that people reaching into the cups to get their ball might leave some virus deposits on the cups. Who thinks about that, right? So maybe there are other things that we're just not thinking about that would come out if we could find out when people test positive exactly how they got it.
In order for the governor's phased reopening plan to work, he says we need more personal protective equipment, but Washington State still does not have nearly enough. Kathy Ray is a critical care nurse at Harborview, and she says PPE there has been tight.
Sometimes staff will wear their N95 so long because we have to. Noses are red. We will have breakdown on our noses. It's really exhausting. But it's important work. And even outside of the room, we are adhering to those social distancing and universal masking. So when I leave, I'll put on a simple mask.
And because there's a lack of a larger federal distribution system, our state has had to go out and track down PPE from around the world on our own. Here's Reed Schuler, the governor's policy advisor.
We've obligated $400 million for PPE purchases. More than 30 times the cumulative total that we have received so far remains incoming. So this effort is continuing to mount.
And that means Washington does not have a sustainable supply to hand out to healthcare workers, and they also can't start distributing it to people in, say, the construction industry who also want to go back to work. I'm not sure what the solution is to finding the necessary amount of PPE, Dave, but clearly there's this huge gap in supplies needed.
This is absurd. So much for the war metaphor, right? If we're at war, we've done a darn poor job of equipping ourselves. And I thought that we had this Defense Production Act where the president could order industries to drop what they were doing and make the stuff that we need to win. And I just saw the figures that Hannah Scott researched for us on the orders that the state has out for this equipment and the rate of fulfillment. And it's pathetic. You're getting less than half of what they have promised to deliver. Now, maybe it's physically impossible, but I get the sense that this is every state for itself. Is that the way you fight a national pandemic? Apparently not, because it's not working. So I would love to hear that question asked, and I don't know that it's going to be, because the president has now moved on from the original purpose of the coronavirus task force. But again, and I keep saying it, you can reopen all you want, but if people aren't confident to come out, it's not going to help the restaurants. And if people are confident enough to come out, and they do come out, and then they get sick, so they're laid up again, except this time they're in a hospital, that's not going to help the economy either. So it would be nice to see just a tad more leadership on getting that stuff manufactured and handed out.
And what's also frustrating, Dave, is this is a story we've been following for well over a month now. I mean, the fact that we don't have enough PPE. I did a story several weeks ago, and I went out to the Joint Information Center out there in Camp Murray. And even a few weeks ago, they were talking that they had something like, nearly 3,000 total orders from around the states, people who are requesting PPE, and then they had around 700 completed. So about 700 out of 3,000 total requests were even being allowed to be fulfilled. And when they were fulfilled, they weren't full orders. They were only partially filling them. So, I mean, this has been an issue we've been talking about for weeks now.
Well, maybe somebody who can do something about it is listening to us now, Aaron.
I hope so. Restaurants in our states can now sell cocktails to go. Effective immediately, you can order mixed drinks with your takeout order or have them delivered directly to your door. Now, there are a couple of rules, of course. You'll have to order a bona fide complete meal, the state says, alongside with your drink. And your pina colada must be packaged in a container with a secure lid or cap. And you can't stick a straw in or sip it like a coffee to go while you walk. Hopefully this will help restaurants out with their bottom line, since mixed drinks are one of the industry's biggest profits. Dave, I'm not sure how much of a drinker you are, but I know you've also been cooped up in your house for quite some time, and I know you don't go to the store all that often, I think. So is this you going to get some to go or to drinks ordered to your door?
I do sip a little whiskey once in a while, but I just because I'm sort of prudish when it comes to alcohol, I don't want to impose that on anybody else who wants to drink responsibly and is staying home instead of driving. And it's too bad that you can't, while you're walking down the street, take a sip of your pina colada. I mean, in New Orleans, they've gotten away with that for years.
Vegas,
but I mean, if you're walking around the neighborhood, why not? As long as you conduct yourself in a civilized manner. But I'm glad that there's at least more help for restaurants. I know they make a lot of money selling drinks. As I understand it, though, you can't just order the drink. Mm-hmm. You have to have food with it.
Correct.
Right?
Yes. Yeah.
Okay. Are you required to eat the food? That's what I'm thinking. Yeah, get the food with the drink, but you can always refrigerate the food and eat it later.
Right.
And that helps the restaurant too.
I lived in Arizona for a while, and they've had drive-through liquor stores there for, ever when I was there 15, 20 years ago.
Yeah,
so
that seems a bad idea even when times are normal.
You think so?
Yeah, drive-through liquor store.
I don't know.
I mean, do they actually make you put it in the trunk, or they just hand it to you?
Yeah, I mean, it's like a fast food experience. Yeah, I mean, you say, hey, can I have that bottle of whiskey? And they hand it to you. And, I mean, you're expected to put it in your back seat or something. But,
anytime I hear the words driving and liquor in the same sentence, I don't feel secure. But again, if people want to walk up and down the neighborhood streets with a pina colada, I think that should be okay. We will be back tomorrow and every day after with a 10-minute rundown of the daily local news. You can subscribe to this podcast, and you can also find our news coverage on mynorthwest.com or listen live at 97.3 FM.